There. Shoot. So, okay, so just to get started, I know that many people out here may feel like the board of directors just kind of meets and chit-chats and has fun. So I just want to show kind of, what we do, how active we are. I know that also there are some people out there who might say that, some of the people in our organizations and some doctors may be hard to talk to. They think they're very kind of on top of the world. Where's my video? Okay, skipping the video. I'll send it out to you guys later so you can watch it. A couple of very, very, very quickly, just some of the accomplishments that I think we want to touch on. During COVID, there were a lot of different needs in the Jamaat that SBMAA and its members took on as an initiative to help organize Jamaats and make sure that they are safe and providing care for the Mu'mineen in their Jamaat. And so there were, as I think was mentioned before, PPE distributions. There was discussions about ghusl and the best ways to be able to perform that safely. SBMAA also participated in many and supported many initiatives overseas in India and in other places. Distribution of AEDs, Miles for Mola campaign, and Ashara scholarships are some other initiatives that SBMAA has participated in. And we're really proud of these conferences. I think that there are many, many familiar faces. There's so many people that I've personally met at the conferences and gotten to know over the last 4 years, and I'm sure you'll see that you're meeting new people and making new contacts and networking with people here as well. And having fun, of course. Mentorship, this is a big deal, right? We have a lot of young people who are interested in medicine, and we are their mentors, we are their guides, and so there's a great program that's in the works that is already growing for mentorship for young college students to help them grow into wonderful physicians and other health professionals. Our YouTube channel, again, providing content, spreading content, not only around North America, but in around the world. And a lot of the content here will also be presented in the YouTube channel. We're creating a database of all health professionals, and we're requesting that everyone here, if you haven't registered in our database, to please register yourselves. It's important for physicians and health professionals to be able to network. Data is safe. It's not being distributed elsewhere. But it's important for us to be able to get in touch with each other to help each other. The last thing is collaborations, and this has been mentioned a couple of times, but I think it's really important. We have two goals in SBMAA. One is internally in North America to support our local health professionals and with that to support our Jamaats. So collaborations with Madrasa Kalimia to prepare a parenting curriculum that'll be spoken about. And then outside, and also in North America, working with Umar Sehat to be able to distribute knowledge and connect Jamaats together in many of the similar initiatives. And then outside of the US, our other initiatives to collaborate with other organizations like Al Jamiatu Safia and Safi Hospital to be able to provide our expertise and support for those organizations as well. So we're going to get into our initiatives. I'm going to ask that each person introduce themselves just for time's sake.
My name is Alefia Al-Kamari. I am a hospitalist and an assistant professor of medicine at Rush University in Chicago. थोड़ा वर्ष पहला मोला ये आई थिंक मिलाद निवाज़ में जमनी तरफ खिदमत गुजारों ने खिताब करता हुआ फरमायो कि पूरी ताकत सी तमें खिदमत उठाओ जो and that's where we took our motivation and started the physical and mental wellness programs અને શુક્રન અલ્હમ્દુલિલ્લાહ हमने चारे जामियाओं में खिदमत करवानो मौके मिलो છે. Recognizing that जामियाना तलबात and asatiza are the leaders currently and in the future અને जहाँ it's the base of all ilm અને મોલા अपने mind maps બનાવી ચુકા છે about what lifestyle we should be living and how to incorporate these things, kind of lifestyle pillars in daily practice. So we had the opportunity of running physical health camps at the 4 jamias. And really the goal was to instill je ilm already che, but kind of add scientific basis to it about how medicine and what the recent guidelines and best practices are and teach the talabat and talibat about nutrition, sleep, physical fitness, and behavioral change. This year we were lucky enough to incorporate dental health as an initiative also.
Me, Dr. Rashida Sefi Chu. I'm a pediatrician. Ne mulan dwarasi a health and wellness nander khidmat karwano mauke milo che. तो हमें अभी लास्ट 2 years ना दरमियान 4 जामियान अंदर वर्कशॉप्स कंडक्ट किया है जिन अंदर जम डॉक्टर अलिफा बिने कही कि आ सगली चीज़ों कि मेंटल ना फिजिकल हेल्थ बनने चीज़ इंटरट्वाइंड है तो बनने ना वर्कशॉप्स किया जिन अंदर न्यूट्रिशन है एक्सरसाइज है डेंटल हेल्थ है और इन अंदर मेंटल हेल्थ नी चीज़ों जिन अंदर अपने फर्जंदों ने नज़ात जाने सेल्फ केयर माइंडफुलनेस रेजिलियंस की बिल्ड था ताकि अल्टीमेट गोल एम है कि ओवरऑल वेलनेस होई मेंटल फिजिकल और इमोशनल तो पूरे तरीके से मौलानी खिदमत अपने करी सकिए ये गोल से आ सकला वर्कशॉप्स की डा तो पहलू वर्कशॉप मुंबासा में थयु तो नेरोबी जामिया वास्ते पछी लास्ट ईयर इस्तेफादा ना दरमियान मरोल अने सूरत जामिया वास्ते वर्कशॉप की डा पछी कराची गया था जिलकाद में वहाँ वर्कशॉप्स की डा प्लस 1-on-1 भी घना सेशंस थया जिनासी घना फ़ायदो लीडो बीजू ऑनगोइंग आनंदर एम થઈ રહ્યું છે કે વર્ચ્યુઅલ સેશન્સ भी ડેવલપ કરી રહ્યા છે કેમ કે આ ખાલી કંઈ વન ટાઈમ નથી કે આપણે એક વર્કશોપ કરીને સગલાને ફાયદો પહોંચાડી શકીએ છીએ ઓનગોઈંગ ફાયદો પહોંચાડવાનો છે તો વર્ચ્યુઅલ સેશન્સના મેં થોડા આપ સગલાને ટોપિક્સ શેર કરું છું કેમ કે આના વાસ્તે આપણે ફર્ધર વોલન્ટિયર્સની જરૂરત છે કેમ કે થોડું કામ થઈ ગયું છે પણ હજી ઘણું કામ બાકી છે તો થોડા ટોપિક્સ મેં આપના સાથે શેર કરું છું સ્લીપ effectiveness, fatigue, focus and attention, ताकि executive functional skills बेहतर थाई सके, building social skills, building self-esteem, study skills, weight loss, weight gain, dental health. आ थोड़ा rough topics छे तो जिन्हें आ सकला में interest हुए तो आप सकला please आगे लाओ जो. छेल्लू एम के एजुकेशनल वीडियो सीरीज़ आ थोड़ी वीडियो सीरीज़ अपने ऑलरेडी तैयार करी चुका है जेम के एकदम बेसिक टॉपिक्स सी जेम के फीमेल प्यूबर्टी मेल प्यूबर्टी PCOS केम के आ बड़ी नानी चीज़ों सी जीवारे सगलू बराबर सी माइंडफुलनेस होई छे अवेरनेस होई छे तो आगल ए लोगोनी तालीम भी बराबर થઈ શકે છે ને એ લોકોનું પરફોર્મન્સ भी बराबर થઈ શકે છે તો હવે આગળ ડૉક્ટર અલેફાબેન કહેશે કે આપની શું વોલન્ટિયર નીડ્સ છે
Kim Chu Sagla, I'm Dr. Alifia Bharmal Chu from Dallas, Texas. I'm a clinical psychologist Chu. મોલાનું કારણ મને એહસાન છે કે આ વર્ષના અંદર ઘણા ખિદમતના મોકે મિલા છે અમને અને ઘણું કામ કીધું છે પણ ઘણું હજી બાકી છે તો એમાં મેન્ટલ હેલ્થ પ્રોફેશનલ્સનું જરૂરત છે અમને તકરીબન 12 સાયકાઇટ્રિસ્ટ છે ગ્રુપમાં અને 18 મેન્ટલ હેલ્થ પ્રોફેશનલ્સ છે તો એમાં ખાસ ઉમ્મીદ છે કે કોઈ હોય બીજા સ્પીચ એન્ડ લેંગ્વેજ પેથોલોજિસ્ટ સ્કૂલ સાયકોલોજિસ્ટ સ્કૂલ કાઉન્સલર્સ કોઈ હોય તો પ્લીઝ આગળ આવજો અને અલેફિયાબેન ફિઝિકલ હેલ્થ નીડ્સના બારામાં વાત કરશે
from a physical standpoint, अपने nutritionists, dietitians, fitness experts, sleep scientists, data scientists, so हम पे घनी चीज़ों अपने evidence अने data सी analyze करीने अपने present करी आचे साहेब होने पची. Pan any chronic illness, both pediatric and adult, and it does not have to be an MD physician. अगर आपने लागे कि मने आ चीज़ में खिदमत आपवी से तो please हमने कोई ने भी contact कर जो and we'll be happy to work together. शुक्रान.
Next screen, please. Parenting curriculum. Afzal Salam, can we bring the screen on for the parenting curriculum, please? Or I do it. Okay, thank you. Okay, for the parenting curriculum, my name is Lulua Manviwal. I'm one of the pediatricians, Bakersfield C. आप सगला ने शायद याद हसे कि पिछला वरस parenting curriculum needs assessment survey present किदू हतो इन बदे data जे हतो. As a recap, for those of you who may not be familiar with our initiative, the parenting curriculum was sought out to help educate parents about the negative influences their children are exposed to, highlighting the unique experiences growing up as a North American woman child, to teach evidence-based parenting techniques, and to improve communication and relationships with their children, and also to provide peer support, which the needs assessment helped develop, and resources for specific problems that are being faced by our Mu'mineen families. At the end of our conference last year, many of you may remember, in Dallas, we received incredible positive feedback from this support. We created subgroups consisting of physicians, teachers, psychologists, and parents, and education experts. Alhamdulillah, we received Raza to move forward to create a pilot program, curriculum. Asal, with the help of these subgroups and with the leadership of education experts, we have begun to develop curriculum content of the topics that were derived from the needs assessment surveys, using evidence-based research. Our goal this year, Molani Duasi, is to execute our pilot program through multiple sessions for parents of one daraja or age range of students in the upcoming madrasa academic year, starting in 1447, inshallah. Additionally, as a huge triumph, we are very proud that we were able to present a poster at the globally renowned Pediatric Academic Societies meeting of 2024 in Toronto, Canada. This meeting is a high-quality scientific research forum for international providers to share and collaborate for improving pediatric health. Two of our members of the parenting curriculum group attended, Dr. Alefia bin Malbari and Rashida bin Haveliwala, and they were very well received. In the near future, we will need your support to help these programs in various jamia. If not yourself, if you happen to know somebody who happens to be an educator, who happens to be a teacher, who knows anything about curriculum development, physicians and parents alike, anyone who is interested in teaching. But we also need somebody who is also interested in getting educated on how to present the course. We're going to need your help and support. So please provide their resources as well. Again, you don't need to be an expert in the field of providing knowledge about communication and building relationships, but you have to be willing to get educated on it. Inshallah, with all of your support and Molani Duasi, we'll be able to do this successfully. Shukran.
Assalamu alaikum. So, હવે સેફી હોસ્પિટલનો જેમ થોડુંક અરજ થઈ કે આપણે આવી રીતે જે કોલેબોરેટિવ એફર્ટ્સ કરી રહ્યા છે એમાં આ બે સર્વિસ લાઇન્સનું શરૂ કર્યું છે એમાં એક ડૉક્ટર ખદીર કાકલ અને ડૉક્ટર મોહમ્મદભાઈ મોગરીએ પલ્મનરી અને ક્રિટિકલ કેરનું કરેલું જેમાં 15થી 20 ફિઝિશિયન્સ આવેલા ફ્રોમ ધ સેફી હોસ્પિટલ અને અબાઉટ તકરીબન 2.5 hours ડિસ્કશન થયું અને ઘણું ફ્રૂટફુલ ડિસ્કશન થયું ને ઇન્શાલ્લાહ એ આગળ વધે અને એમાંથી જે વાતો થઈ આગળ વધે પછી એક બીજું થયું ન્યુરો સાયન્સીસમાં જેમાં ડૉક્ટર અલીઅસગરભાઈ સહેરવાલા અને ડૉક્ટર આમિરભાઈ બદરુદ્દીન અને માયસેલ્ફે ન્યુરો સાયન્સીસની સ્ટ્રોકની વાત કીધી અને એમાં બી 10-15 ફિઝિશિયન્સ હતા તો એમ ઉમ્મીદ છે કે હવે આ જે લાઇન્સો શરૂ કરીએ છીએ એ ફર્ધર થાય અને ઉમ્મીદ છે કે આ સગલી લાઈનો શરૂ થાય અને એમાં જે આપણામાં ફિઝિશિયન્સ છે PAs છે બીજા allied health professionals છે જે આમાં involve થવું હોય તો પછી આપણે મને contact કરીએ and we can start these lines. We do need leads for them. And ummid che this is a long-term goal. This is not a short-term thing that we do one webinar and it's over, but that we create a dialogue where we can share best practices and improve the practices for ourselves and for Safi Hospital. We're also starting this surgical procedure, so we're going to, inshallah, be doing a watchman procedure. There are other procedures that can be done that in Ainda any maybe takbir thai. We're trying to do, we want to institute rotations there. So apne che apna medical students wa jai sakene, like abroad rotations kare lokana not only for their medical school but resume waste bhi ane for the experience, different experience waste ane sathe apna physicians bhi wa jai ane rotations kare, learn from those physicians ane e physicians one aje best practices no je theme che e share kare ane uplift hai. So we are going to have a workshop inshallah on kale saware during the breakfast time to apne malsu ane je loko ne interest hoy to please aujo ane let's try to create some of those new service lines beyond the two that we have. Shukran.
Bismillahirrahmanirrahim. This is one of the other initiatives that SBMAA is doing, which is the webinar series. We hope to have every month a webinar on our YouTube channel that we disperse throughout all Umur Sehat across the country. This is to increase educational opportunities for health professionals. Awaras apne ummeed che ki apne allied health professionals, dietitians, pharmacists, bija health professionals ne apne saath laiye, and we have them once a month give talks on things that they've done in their own jamaat, things that they are experts in, taki bija ne faydo mile. We realize ki here aap saglana ghana ulkhan che, you know a lot of people who know a lot of people, and if you think that there's someone that you know who would be very valuable in speaking about this, then please have them come forward, tell us ki I know ki ache and they are really good at speaking about this, they're really passionate about this, they've done this really cool thing, and we can have them on as one of our presenters avaras inshallah.
So I'm going to touch on a few more initiatives. One of them was mentioned in the khitab with Shehzada Sahab was the EHR implementation for Al Jamia to Safia. This is something that SBMAA has collaborated with Al Jamia to discuss what their needs are and how we can help them improve health care for Talabat and for Khidmat Guzars as they travel around the world on Khidmat to ensure their health is protected and also to help them with initiatives of preventative care, so to be able to help them on those fronts as well. We are in need of people who are involved in any way with EHR development or hospital implementations, or people who maybe have been a part of their own EHR implementation who have some expertise in those areas. So we would love to get anyone involved with that type of expertise. Another program that we're working on is named by Aziz Bhai Poonawala, who has all these acronyms, but it is the Second Opinion Service. So the essential platform for this is to be able to, I think many physicians in the room already provide consultations for people around the world, second opinions for people who may have medical needs. We're looking to develop a platform that allows for these consultations to be more formalized, to be able to view records in a better way, and to be able to collaborate with other physicians. So if somebody has a need for pulmonary and nephrology, they can both work together to support a patient overseas for second opinions. So again, in this, we're looking for a lot of some similarities. People who are interested in some leadership roles, we are in need of that. We're also currently working on development. So this program is in the stage of programming. So people who have interests in that as well. Okay. That's the last initiative that we want to bring up. There are other things as well, and the last thing I would mention is, everyone has ideas. So we look for ideas. I think at the end on Sunday, we'll have a conversation about maybe some ideas that you all have, give people a chance to stand up and speak about maybe some initiatives that they'd like to see SBMA help them organize. So we're here to help all of you with a lot of the initiatives that you may be already taking on in your Jamaat that may be valuable for other Jamaats. We're going to dive into some questions. How much time do we have? 10 minutes? 10 minutes. Okay, so anyone with any questions or comments about any of the initiatives that you've seen here, I would just like to open the floor. Do we have a mic